Hey guys, it's Dave. Today we're going to talk about blepharitis or granulated eyelids. It's one of the most common ocular conditions and in fact accounts for 40 to 5% of all visits to the optometrist or ophthalmologist. It is a condition of the eyelid itself where you will see inflammation. There'll be redness, burning, itching, scaling on the actual eyelid itself, and along with that you can see crusting like you did when you were a little kid when your eyes would get all mattery and you couldn't open them up, sometimes associated with pink eye, except this occurs mainly in adults. With it, you'll have a burning sensation. Like I said, a lot of itchiness will occur. If you try and put in eye drops or even ointment to help soothe it, you feel like a grainy sensation, which is where the granulated eyelids comes from on that. Excessive tearing, blurred vision can also occur, and sensitivity to bright light. So photophobia will also be associated with this. The good thing about it is not sight threatening. However, it can affect your eyelid margin by changing the eyelid margin itself, which might alter your prescription if you wear glasses, and it can also, because of scarring that can occur to the eyelid, it can make it difficult for you to put contacts in as well. So that's something to remember about that. It can be caused by allergies. It can also be caused by infections. Mainly the infections you're looking at are like herpes simplex or rosacea. With herpes simplex or zoster, you really want to watch out because that itself, if it gets into the eye itself, can be sight threatening. And I have had a patient who lost sight in one of his eyes because of that. So if you have shingles or chicken pox and it's around the face, especially in the eye area, get to your doctor right away. They can do something to help out with that. It does affect everyone, all ages, seen more commonly in adults, but all ages, both sexes, and all races too. So it's a common problem. Like I said, 40 to 45% of all eye doctor visits are because of this. The symptoms are worse in the morning, as most things are. You wake up, you get the crustiness on the eyes, you'll get some flakiness there. It's hard to wake up, get your eyes open, get things going, okay? It can be a chronic problem. That's one of the bad things about it, especially in the elderly. We will see it more on a chronic basis. It can lead to things like styes, like I said, eyelid scarring, which can make it difficult for you to put contacts in. And it can, over long haul, actually change your prescription if you're wearing eyeglasses. As far as prevention, things that you can do daily washings with like baby soap or a mild soap like that. They make over-the-counter eye scrubs. You can do those twice a day. That really helps because actually another thing that can cause this condition are the glands at the base of the eyelash. The oil secreting glands can become blocked, and when they become blocked, it makes you more prone to infection and more prone to the buildup there. So if you use the daily with the baby soap, it will help with that, or the twice a day eye scrubs. The other thing that's important to do is to wash your hands thoroughly, often throughout the day. I know we experience that with COVID, but guess what? It's a good idea, period, for your hygiene. And then keep your hands away from your eyes. And I know your eyes itch during the day, you scratch them, you go like this. I do it all the time. Not a good idea, especially if you're sick, because that will make your eyes more prone to infection, which can lead to this condition. For ladies, make sure you change your eye makeup. Don't be using the same eye makeup you used a couple of years ago. If you have friends or daughters or granddaughters that also use your eye makeup, consider switching it out, especially if you've been sick lately or have had an eye infection. Change that stuff out. It's not worth getting pink eye or getting a condition that can lead to blepharitis. Something else you can do as far as treatment, you can use warm compresses. Get a wash rag, clean wash rag, really hot. Put that warm compress over your eyes. It will help soothe the inflammation. It will also help with the oil glands that I talked about to clear that out. Like I said, lid scrubs are a good idea. If it gets really bad, really itchy, really inflamed, talk to your doctor or optometrist about a steroid. They can get a steroid cream or drop that will help with the inflammation. They also can use antibiotics to help treat it on not a chronic basis, but on a more temperate basis as far as using it for a couple of weeks. I have had a couple of patients that have had to use antibiotics chronically. Not ideal, not my first recommendation by any means, but it is something that they can do as well for treatment. There was a drug approved in 23 called Xdemvy, which is used for blepharitis. It is expensive. You probably have to use a prior authorization to actually get it paid for by your insurance, but it's out there. Remember, the best thing again, good hygiene. With the scrubs and washing your hands, it can prevent long-term problems with this condition.